Hello and welcome to Radiant PT, where we discuss all things pregnancy, childbirth, and postpartum. This is evidence-based care that takes into account the research, my experience as a doctor of physical therapy specializing in pelvic health, as well as, most importantly, you. Your preferences, your lifestyle, your body, your intuition. Let's dive in. Today we're talking about perineal tears during childbirth. The perineum is the area of tissue between the vaginal and the anal openings. It includes the skin as well as the fascia, connective tissue, and muscle underneath. This is the most common area to tear during childbirth, although tears along the labia or inside the vaginal canal can also occur. So what do these tears actually look like, and what does it mean if you get one? A grade 1 tear goes through just the skin on the surface and typically doesn't require any sutures. It also often heals without any ongoing pain or dysfunction. A grade 2 tear goes through the skin as well as into the muscle underneath it. These tears are sometimes sutured and may start to cause some dysfunction, things like leaking urine or painful sex due to scar tissue restrictions as it heals. A grade 3 or 4 tear extends through the skin, through the muscle, and to or through the anal sphincter, respectively. These tears typically do require sutures and can cause ongoing issues with bladder, bowel, and sexual function. PT should always be recommended to anybody who undergoes a more significant tear like these. But I don't want you to panic. A small tear is a natural way that our body can adapt to the process of childbirth and allow that baby to get out. Generally, minor tears heal really well all on their own, especially if you're able to rest and stay off your feet in those early days postpartum. However, more significant tearing is often caused by the way that we in the United States intervene in the process of giving birth. Episiotomy, use of forceps or vacuum, pushing, lying on your back, or coached purple pushing all increase your risk of more severe perineal tears. So what can we do during pregnancy and during birth to decrease our risk? Let's talk about 4 different options. First, we need to train the pelvic floor muscles to get out of the way. Many times, women are told to do lots of Kegels during pregnancy to prevent things like bladder leaks. The problem is that doing, say, 30 Kegels is like doing 30 bicep curls without ever fully extending your arm. We ignore that lengthening part of the range of motion, and we really overdo it with the shortening and contracting part of the range of motion. But the pelvic floor itself does not push the baby out. Instead, we should be learning how to lengthen those pelvic floor muscles. While a strong pelvic floor helps in other ways, like assisting with fetal positioning during labor, when the baby's head or presenting part is pressing and stretching at the perineum, we need those muscles to lengthen enough, to open enough, to make room and get out of the way for the baby to descend through. In pelvic floor PT, we practice releasing and lengthening those muscles by doing diaphragmatic breathing. You can get even more benefit out of your pelvic floor relaxation practice by adding in some hip stretches. In a deep squat, practice breathing into your belly. Think about inhaling the breath down and out. As you inhale, allow the belly to expand. Then start to breathe downward into your pelvic floor. With each inhale, think about dropping and opening through the vagina, like you're trying to pee in the ocean. As you exhale, go ahead and just let that tension go. If a deep squat is uncomfortable, try sitting on a yoga block or holding onto the side of a couch for support. It should get more comfortable as your range of motion and flexibility improve. The second way to prevent more severe tearing is through perineal preparation. Maybe you've heard of perineal massage before. This isn't quite the same thing. Recent research has shown that perineal massage, where you're massaging the tissue to increase blood flow, really isn't that effective in preventing tearing at all. But what I teach with my clients and what I used for my own birth is actually something called neuromuscular re-education. Using lubricant and, if possible, a partner, if not, maybe something like a Therawand, you stretch the vaginal opening downwards starting at 6 o'clock and holding the stretch for a long time, like 2 minutes at least. All the while, you're doing the diaphragmatic breathing that we talked about in step 1. Each time you inhale, relax into that stretch a little bit more. Exhale and just let the tension go. You're gonna repeat that stretch at 5 o'clock and at 7 o'clock. You might feel a little bit of light burning, but that should ease up as you relax into the stretch. The goal is to get your muscles used to the feeling and the sensation of a big stretch, so the first time that they feel it is not during birth. See, every muscle in your whole body has stretch receptors that are designed to protect you from injury. If a muscle senses that it's being stretched to an unsafe length, it will automatically and reflexively contract in order to protect the affected joint. But tight contracted muscles during labor, if you're fighting the stretch of the baby descending, that's only going to increase your risk of tearing more severely. If you're somebody who has a history of pain with tampons, gynecology visits, or sex, or you have any history of sexual trauma, it's particularly important that you work on this. It should not be painful. It's gonna be counterproductive if you're just tensing up as you practice the stretch. Okay, number 3. Did you know that the only reason that women lie on their back with feet in stirrups to give birth is because Louis XIV of France decided that he wanted to watch? Over time, the use of the position persisted because patriarchal obstetricians decided that they could better see and control what was happening in this position, regardless of if it was actually better for the woman. Recently, we've been able to see that lying on your back actually blocks the sacrum and blocks it from being able to open, as well as puts you in a position to basically be pushing uphill against gravity. More work for you means more really hard pushing and a greater chance that your baby might get stuck and require additional intervention. The best option is to tune inward and listen to the position that your body and your baby want you to be in for pushing. But some great options to have in your back pocket are gonna be positions like pushing on your hands and knees, a kneeling runner's lunge, a supported mini squat, or if you have an epidural, lying on your side, maybe with a peanut ball. The 4th way that we can help decrease our risk of more severe tearing is by learning a more physiological pushing technique. AKA, we're pushing with an open glottis, which means that you are not holding your breath. Currently, in the United States, most women are pushing way too early, like right when they hit 10 centimeters. Because at this point, the baby is not low enough in the pelvis. We have to push way too long and way too hard to get the baby to descend through. So most women are coached to hold their breath and bear down as hard as they can while the nurse or OB counts to 10. This is called coached purple pushing. And again, it increases your risk of more severe injury. Learning to work with the physiological birth process means waiting to labor down. Essentially, we're waiting for the uterus to do the work of pushing the baby down until you feel that undeniable, uncontrollable urge to push. At this point, sending the breath downward without holding is really helpful. During that moment of crowning or when you feel the ring of fire, it might be helpful to try some techniques like panting or even horse lips, which help to just slow down that pushing phase and give the perineum time to stretch and adapt. Again, listening to your body is always key. Seeing a knowledgeable pelvic floor PT during pregnancy will help you learn all of these techniques in so much greater detail. So if you're feeling stuck or lost, please seek out some additional support. If you have any questions about perineal tearing, please leave them for me below. I would also love to hear any other topics that you're interested in me covering, either here on my YouTube channel, or you can check me out at radiant.pt on Instagram. If you've enjoyed this video, please give me a thumbs up, hit subscribe so you don't miss my new and upcoming weekly content. Remember that this video is information and inspiration, not medical advice. Make sure that you're having conversations with your healthcare team and always, always listen to your body and your intuition. Thank you so much for being here. I'll see you soon.